Today we are going to see what are the top 100 most repeated topics of NEET PG and FMG, and these are one of the most important topics for NEET PG 2025 and FMG 2025. So I am Dr. Mayukh Hazra. I had got AI 29 in NEET PG 2023 and a second year dermatology resident. So the target of this video is 300 subscribers or 500 likes. If you fulfill this, then you would get the PDF for free. In this video, I am not only going to tell you the topics, important topics, but how the questions are also asked. So stay till the very end of the video. Starting cell injury and adaptation. So the basic of necrosis and apoptosis. After that is ankylosing spondylitis. This is asked multiple number of times, and why I have given a highlight, because I have given highlight in those topics which are short topic but are multiple repeated. Like cell injury and adaptation is a broad topic. What are the tests for necrosis and apoptosis? What are the types of necrosis? It is a broad topic. But ankylosing spondylitis is a short topic and it is very much high yielding. After that is glaucoma. Then is congenital hypertrophic pyloric stenosis, rape, mainly the IPC. Now PNS has come, and the test for determining rape, postpartum mood disorders, the three types you all know, croup, management and caused by the virus, or the clinical scenario is given and you have to identify it is croup only. In viruses, CMV multiple times asked, rotavirus vaccination also, HSV, hepatitis B, the markers, JE has been multiple times asked, EBV, hand foot mouth, then rubella, measles, herpes zoster, the clinical image of the dermatomal distribution, it comes in the dermatology part, and parvo B19 has been asked multiple number of times. Malignant hyperthermia, you have to diagnose by the capnography and the clinical scenario. Horner's syndrome, management also you should know. Pneumothorax, mainly you have to identify the clinical scenario, it is a pneumothorax, and you have to tell the management. It is also multiple number of times asked, so I would highlight it also. It is a short topic and multiple number of times asked. After that is hearing aid and cochlear implants. Auditory brainstem implant is also included. A rheumatic fever and rheumatic heart disease. Tumor lysis syndrome, you have to identify the condition and what are the electrolyte imbalances. Vitamins, very high yielding. In NEET PG 2023 and 2024, you have seen how many questions can come from vitamins. In one page only you can summarize all the vitamins, the enzymes that are associated with their deficiency, and the clinical symptoms you have to remember. Local anesthesia, mechanism of action and some of the types. Capnographic waveforms are important, especially that of malignant hyperthermia, bronchospasm, muscle relaxant is reversing, that is the curar cleft. These are some of the important capnographic waveforms. After that is COVID-19, though now it has become less common, but just after the COVID-19, more number of questions for COVID-19 was asked. Maybe one or two could be asked, though less chances. After that is tonsillectomy, mainly the complications, that is the hemorrhage, reactionary hemorrhage, delayed hemorrhage and all. The eating disorders, anorexia nervosa, bulimia nervosa, retinoblastoma, cystic fibrosis, clinical features and the tests, skull fractures, all the types, electron transport chain and the uncouplers, alcohol related to psychiatry, that is delirium tremens, Wernicke syndrome, Wernicke-Korsakoff psychosis, malignant hypothermia, it has been repeated. Sorry for that. I would change it when I provide you the PDF. Gluconeogenesis, glycolysis and glycogenolysis, the steps. The important regulatory steps are only important. Perioperative monitoring of CNS, conjunctivitis, bacterial and viral, BLS and ACLS, it is important. Multiple times it has been asked, the BLS and the ACLS. You can expect one question from this only. Rheumatoid arthritis, and it is only rheumatoid arthritis. Types of graft and rejections, scurvy, and rickets. The X-ray images are given and asked what is the condition. Muscle relaxants are asked multiple number of times. Myasthenia gravis, postmortem changes, that is the early and the late changes you have to remember. Sleep and EEG, in most of the cases the EEG shows REM sleep only. Contact dermatitis, atopic dermatitis, and also the patch testing, because in contact dermatitis we do the patch testing, so patch testing is also important. Now pemphigus vulgaris and bullous pemphigoid foliaceus is less commonly asked. CHPS has been repeated once again, sorry for that. Mechanical ventilation, gastroschisis and omphalocele. Myasthenia gravis, it is also a short topic and repeated by the clinical scenario. What is the diagnosis? Alkaptonuria, retinoblastoma and retinitis pigmentosa, you can take it. Okay, this is not retinoblastoma, this is retinitis pigmentosa. So asphyxia, strangulation is important. Phenylketonuria, otitis media and CSOM, GI motility disorders, pterygium, pterygium pinguicula, pre-operative antibiotic prophylaxis. Contraception is very much important. The emergency contraception and the permanent contraceptions, especially tinea capitis types, gray dot, black dot, carry on, and all. Drowning is also important. Freshwater drowning and seawater drowning. Inclusion bodies, the viral inclusion bodies, bacterial and viral conjunctivitis, cerebral palsy, important diseases and bacteria. Pseudomonas, gonorrhea has been asked multiple number of times. Gonorrhea has been asked multiple number of times. Urethritis, UTI, anthrax, bioterrorism agents also asked in INICET. H. pylori, streptococcus toxins and virulence. Mycology, the whole of mycology is important for NEET PG and INICET. Hodgkin's and non-Hodgkin's lymphoma, aortic dissection questions are asked. Acute tonsillitis, sterilization, cerebral palsy, CVA management, especially when you do thrombolysis and when you avoid thrombolysis. Trichomonas, leishmania, leishmania is asked multiple number of times. Filaria, the types of filarial worms. Nematodes, Giardia, Toxoplasma, E. coli, and liver flukes. Urea cycle and disorders, meningitis, lysosomal storage disorders, alkaptonuria, TEN and SJS, erythema related terms, that is erythema marginatum, erythema induratum, erythema nodosum, these all things. Dyslipidemia, the drugs used in dyslipidemia and the newer drugs, the anti-glaucoma drugs. Genetic inheritance is very much important. One or two questions you can expect from this: the autosomal recessive, dominant, X-linked, and mitochondrial. You can get the pedigree chart also, and you may be asked which kind of disorder is this. Genetic. Hypersensitivity reactions, zero order and first order kinetics, DNA replication and repair defects. What are the diseases caused? That could also be asked. Extraocular muscles and their functions, the pharyngeal arches, parotid abscess, fetal circulation, teratogenic drugs, which all are the teratogenic drugs and what are the effects they cause. Glycogen storage disorders, in asphyxia, strangulation is important. Renal tubular acidosis, drowning is important. Retinal detachment and the management of retinal detachment. Psoriasis, among dermatology, the histopathological appearances and types of psoriasis. With that, what is the management of the different types of psoriasis? Thalassemia and sickle cell anemia, multiple myeloma, muscles of mastications in NEET PG 2023 also it was asked. Lung cancer, what are the different types of lung cancer, especially the histopathological variants, and the small cell cancer, non-small cell cancer, squamous cell cancer. The staging is not that much important in perspective of NEET PG. Myocarditis, firearm injuries and Marshall's triad. Alkalosis and acidosis, all the questions related to alkalosis and acidosis, whether it is respiratory or metabolic. The easy mnemonic is seeing the PCO2 and the bicarbonate level. If it is on the same side, that is respiratory opposite. If it is in the opposite side, they are rising and decreasing, then it is respiratory. And if it is going in the same side, that is the PCO2 and the bicarbonate level, then metabolic same side. Okay, this by this you can easily remember the ROMS mnemonic. Amenorrhea, in case of gynae, it is very much important. What are the different types of amenorrhea? And transverse vaginal septum and imperforate hymens are multiple time asked topics. Sympathetic ophthalmia, infertility, the semen analysis is also included, so this is also important. And chromosomal abnormalities, that is the karyotypic abnormalities like the Turner syndrome, Down syndrome, Patau syndrome, Edward syndrome, these are important, and their antenatal screening is important. So you can get the topic list by completing the 300 subscribers and 500 likes. I will wait till then, and I will provide it in the Telegram channel. The link of the Telegram channel is given in the description box below. And those who have joined my Telegram channel, they would get the list now only. So if you want to get the list now only, you can join to my channel. And others, please share the video so that we can reach the target, and I would give this PDF free of cost. So all the best, take care, and prepare well for your NEET PG and FMGE.